So our first speaker tonight is David Bowie, the CEO of SAS Australia and New Zealand, who has both a commercial view of mental health but a very personal view as well. So please join me in welcoming David Bowie.
Thank you, Luke, and good evening, everyone. I guess when you see David Bowie's name up, for those of you disappointed, you can tell I'm not the thin white duke. As much as I'd like to spend more time writing and be a bit thinner than I am. But great to see so many people here today. I came here tonight not as a health professional. My experiences with mental health are not lived experiences. But I certainly have learned experiences that I've learned in my role as CEO of SAS in Australia and New Zealand. And to just share a bit of that journey, that learned experience, and why I think this is such an important topic for employers and employees. The company I run is a subsidiary of a US software company selling analytics software and services. We've been around about 40 years. As the CEO, I have the pressures you would expect of a sales-driven organisation to hit targets, to drive people hard, to compete and win in the marketplace. But I also have responsibility for the team and the people around me. And over the last several years, we've been one of the highest performing countries in the SaaS world. And we've had that based on a strong culture. A culture built on trust and a culture built on people. And I can assure you the evidence is there that a strong trust-based culture will always outperform one that's based on fear, uncertainty and doubt. And the programs we've had have been all about that. And I've got a great team around me, some of whom are in the room tonight, who've put those programs in place to allow us to have a good, strong, supportive culture. With all of that in place, I know a couple of years ago, or probably actually not much more than a year ago, I had a number of aha moments. And I realised that within that healthy work environment of high-achieving people, with programs that are focused on the financial, mental and physical well-being of our people, there was still a dark corner. There was a dark corner of people still suffering badly from mental health issues. And my realisation that came from, we have a global program called Data for Good. And as a software company with our corporate social responsibility, we were given the opportunity locally to reach out to any charity organisation we wanted to offer our skills and our support and software for free to an organisation. And so we asked the staff, who should we be working with? And fairly overwhelmingly, the organisation that was voted for with no multiple choice was Black Dog Institute. Now, I was personally happy with that. I knew a number of people on the board at Black Dog. But it was an interesting story. It's not a popular charity, but Black Dog, for those of you who don't know it, is focused on mental health research. And that began to tell a bit of a story. So we started working with Black Dog, we are working with them around a particular program they have called Lifespan. And Lifespan has a target, an aggressive target of 20% reduction in successful suicide attempts and 30% reduction in attempted suicide. And we've been working with them, and we've had Black Dog come along and talk to our staff about what our program is. And through that, I realised people were so proud of being part of SAS, seeing that work and seeing it was actually making a difference in the community, and they connected to it. People wanted to be involved, they wanted to hear the story, they wanted to work on the project. And it led me to probably my next big aha moment at our company kickoff at the beginning of this year, where you have 350 people in a room a bit bigger than this. And after having heard from Black Dog, and I stood on stage, and the privilege I have in my position to be able to say, I actually want to go a step further. I want to make SAS a place where it's safe to have a mental health issue, to talk about it, and for us to do something and be a supportive environment. And what I had no idea about was what response would that result in. I had not got much further off the stage, and I had one of our senior managers come and give me a hug and break into tears and begin to tell me his story of how he's been suffering. I gave one of our consultants based in Melbourne, I gave her a lift home because she wanted to talk to me on the way home about her struggles that she's had for the last 15 years and how that affects her work day to day. And what I found was a series of people reaching out to me individually and saying, I want to talk to you about what you said on stage and what I'm going through. And that sort of led to a realisation. What I found was they were happy to talk to me because I'd said on stage, I want to make it a safe place. They weren't necessarily happy to talk to their manager. There was still something there that was preventing them being open about it with their manager. So we started to look at, well, how are we going to educate our teams and our managers about this so that those conversations can happen? And that journey started. But perhaps one of my biggest aha moments was my own son, who was in year 11, he's 19 now. He dropped out of school at the end of year 11. And because he couldn't handle the pressure of school, he ran away from home. He was diagnosed with depression. And we had to start learning what that means in a family context. And I took him along, and he was disconnected from school, disconnected from community, alone and needing to feel supported. And when the Garden Room Initiative kicked off, I thought, great, this is something I can connect him to feel part of something, you know, sort of pseudo-school environment. The first one of these was at his old school. I thought, I'll take him along. My attitude was, I'll take him along and he'll hear something and some light will go off and it'll fix him. You know, a parent, you want to fix. When your kids have something go wrong, you want to fix it. And I got him there, which was a big thing at the time. He was in a bad way. I got him out of the house, got him to there, listen to a great panel of speakers telling their own story. And about halfway through it, I was sitting there and I realised, actually, I'm the one that's learning here. I'm the one who's going to take a lot more out of this than he is about what it means to deal with mental health. And as I was doing that, I heard one of the speakers refer to Family 2.0. And that's sort of being an IT guy, that sort of resonated with me. Family 2.0 was about changing our expectations of what it means, what our hopes and dreams are, and how to change those, adjust those to support someone with mental health issues. And when I took Will out of, when we finished the session, rather than ask him the normal question, which is, you know, what did you learn out of that? I said, what did you want me to learn out of that? You know, was there somewhere where someone said something that you thought, I really hope Dad's listening? And he said, when they were talking about really deeply listening to me. And that was a big impact. And I spent a lot of time with the kids, and it wasn't as though I don't listen, but it was listening at a different level. And as much as that applies to him, that applies in the workplace as well. Be able to stop and listen. You don't have to have a mental health problem to be able to recognise it and to be able to support it. And that sort of flavoured my view of what we need to do in the workplace and why it's such an important topic for the workplace, and why, not being a health professional, I'm honoured to be here with some great professionals, and looking forward to the conversations tonight.